Join me for a full face of Hyperdilute Radiesse for this patient. She originally presented for HA filler in the face, but I decided to pivot for her. Looking at her folds, I don't think they were aging her. I think she looks beautiful. I love the contour of her cheek. She doesn't have strong marionette lines, so I said, no ma'am. We did do a little Evolysse smooth in her lips, but now our goal is to really strengthen the collagen network, and we chose to use Hyperdilute Radiesse. She has done this treatment before and absolutely loved the results. So my markings are really to strengthen the frame of her face, a little bit in the temple, the cheek, the preauricular area, and that lower face jawline. I chose to do a 1:4 dilution. I love the publication by Dr. Akash, Alec McCarthy, and Dr. Danny Soares, talking about the different dilutions and how it affects the G prime, and I'll pin it here, the G prime of Radiesse, and how really after a 1:1 dilution, really you're just utilizing this product as a biostimulator regenerative product. So I chose to do a 1:4 on her, and it performed really, really beautifully. I love a 1:3 or a 1:4 typically in the face and in the neck as well. I typically sit under a 1:1 dilution when I'm really wanting to use it as a true volumizer. So for me, my first poke was a little bit of lidocaine with epi. I used a 23 gauge port, and now I'm using a 25 by 2 inch cannula. I'm trying to live in the plane that has the most concentrated amount of fibroblasts, and that is really in that superficial subcutaneous plane and that subdermal right below the dermis where most of those fibroblasts live, because remember, I want those Radiesse microspheres to latch onto those fibroblasts and reactivate them. That's how she's going to get that juicy collagen, elastin, proteoglycans, all of that being stimulated in this plane. If I dive too deep, I kind of lose that. So we're just working through the tissue. Whenever I hit resistance, I never forced my cannula through. I'm just knocking on the door and waiting for my cannula to slide in. Those fibers are in control. And then I always retrograde inject. I never lay a stationary bolus, just slow retrograde threads, taking my time. I love a cannula. Some providers prefer a needle for this. I find that it's so much less traumatic to use a cannula for me. And really, if they get any bruising, it's really just at that entry point versus having to re-enter with a needle. But it truly is preference. Everybody has a different way to kind of skin a cat. One thing that I am adamant about is really using a piece of gauze to protect the cannula from our hair. Our hair is super dirty all the time, even if we just washed it. So I'm always making sure that I have a nice piece of clean gauze with a little bit of alcohol, just to make sure that we're not rubbing on the hair and introducing those germs into the tissue. So sitting above that parotid gland right here in this area, making sure that when I'm laying my threads, they are superficial. So if you're unsure, if you're above the parotid, if you tent up that skin, you'll see the shape of the cannula, which tells you that there is nothing between the skin and the cannula, which means the parotid is living underneath it. So always holding a little pressure, using my 23 gauge port again, introducing that needle, and then taking my cannula and working into the tissue, being very mindful of that parotid gland in this area as well. Also being mindful of any vessels. Above me, I have the transverse facial artery going in the direction that I'm moving medially. I'm going to tap on that facial artery. So really understanding the primary real estate in this area, and always moving my cannula when I am pushing product. You'll never see me inject moving forward. It's always retrograde, and I'm never staying still when product is coming out of my cannula. So really the goal is just to kind of wash the face. I call this my face wash or my neck wash if I'm doing Hyperdilute Radiesse in the neck, but I'm using 2 syringes in total, 1 per side at a 1:4 ratio. So that means, if you remember, the Radiesse syringe comes as a 1.5 cc. If you're doing a 1:4 ratio, that's 1 Radiesse to 6 cc's of normal saline, and I mix a little bit of that plain lidocaine in there just for comfort. So 1-to-4 ratio. If you're doing a 1-to-3 ratio, that's 1.5 cc's of Radiesse and 4.5 cc's of normal saline or sterile water, whichever your preferred diluent is. But I love a 1-to-4. I don't worry about little caterpillars in there. I don't worry about having to overly massage the product. I do take time now to blend that product into the tissue just to avoid any lumpy bumpies. But at a 1-to-4 ratio, remember, I'm really just working with a strong biostimulator. I'm not worried about volumization at this dilution. So I know it's going to blend so beautifully. And her first treatment, she within a week was already experiencing such a beautiful glow. So I really love this treatment for really strengthening the internal network of our skin. I highly recommend referencing that publication that I talked about in the beginning of this video. I think it gives you a great understanding of how to work with Radiesse at different dilutions.